I'm Dr. Gautam Banga. So today we'll discuss about erectile dysfunction. So what is exactly erectile issues or erectile dysfunction? So it's the inability of a man to achieve an erection which is sufficient to do sexual activity. So it is not only restricted to old age group. Now a lot of young patients in early 30s and early 40s, they are coming to us with this problem. So it's a widespread issue. It's not something which is just restricted to only few of them. Though it used to be a social stigma and a taboo, but now people with awareness are coming out of it, and now they come to us for the solution. So what are the signs and symptoms? So signs and symptoms are very simple. Anybody who is not able to achieve an erection, or somebody who was having a normal sexual activity was able to have a good hard erection, but now the erection hardness has gone down, or he is not able to achieve the erection, or the erection goes down while doing the sexual activity. So these are the major signs and symptoms of erectile issues. Along with that, if patient is having hypertension and diabetes, along with that, if this decline in erectile function is there, then he should consult an oncologist. So erectile dysfunction have multiple causes. In a young patient, most of the time is because of the early onset diabetes, diabetes which manifests in the early age, or they can have venous leak, which is an anatomical deformity in which the blood comes to the penis, but the patient penis is not able to retain that blood, and the blood goes back through the veins, which stays open at the time of erection. So that is known as venous leak or venous dysfunction. So these are the major causes in the young age group. In the middle age group, the causes are hypertension, long-standing diabetes, chronic alcoholism, smoking, obesity. So these all can contribute as a single entity, or as well as in combination. They can affect the erectile profile of the patient. If you can come to the old age group, the major causes are aging process as well as hypertension and diabetes. So these are the major causes by which erectile dysfunction can happen. So as I said, there are many addictions which can lead to erectile dysfunction. So if you are into smoking, if you are into tobacco chewing, you have to cut down, or if you can eliminate completely these kind of addiction from your life, that will be really great. If you have diabetes, try to keep the sugar low, control it, keep meeting your diabetologist or physician frequently to maintain the blood sugar levels. If you have blood pressure, keep it under control, take your medicine on time. If you are suffering from obesity, try to lose weight and control your diet, eat healthy food, and overall live a healthy lifestyle. That really matters a lot and can help in preventing or decreasing the chances of erectile dysfunction. So when a patient comes to us, we do complete physical examination, laboratory test, and then we sit with the patient and discuss all the options which are available. In majority of patients, somewhere around 60 to 70% of patients who come to us with erectile issues can be managed with medication. So these medications are simple, as and when required kind of medication. You have to take it half an hour, 1 hour or 2 hours before the sexual act. And with this medicine, the blood flow increases and the patient can have a hard, rigid erection, and they can do the sexual act. There are various supplements which are available. In some patients they give good results, in some they give a moderate or mild kind of results. So we can always provide that along with this kind of as and when required medication. So other patients who either respond to medicine and later on become unresponsive, or they are patient who doesn't even respond to medicine in the first instance, in such patient we advise them for penile implant. So there's a major query. Patient comes to us, what exactly is penile implant? So there are two main categories of penile implant. One is malleable implant, which are simple rod with a metallic core, and the patient penis size and shape stays the same after the implantation, and they can do the sexual act. And then there are inflatable implants, which have cylinders and they have reservoir and fluid inside. So when they press the pump, the cylinders get filled with the implant with the fluid. So these are the kind of inflatable implants which have a pump and cylinders, and this tubing get attached to the reservoir in the abdomen. So when they press the pump multiple times, the fluid move from reservoir into the cylinders, and patient can achieve a erection, which is not there in the malleable implant, which are simple rods, and patient can bend it whenever they are not doing any sexual act, and whenever they want to do a sexual activity, they can just take it up and can do the sexual act. So these are very effective modalities, but very specific indication, and those patients who really need them should come forward and go ahead with this surgery. Surgery is very simple, recovery very super smooth, fast, and so it's a simple surgery, but yes, only those patients who really need them should go for that. So my advice to everyone is that erectile dysfunction is not uncommon, and don't get stuck with the social stigma. If you're facing any issue with that, you better consult your oncologist and take treatment in time. Thank you.